Good morning, everybody. No hurricanes in Missouri. Although, and we apparently are going to miss all this. It's supposed to come up through Texas and Arkansas and then turn right and go out into the Atlantic Ocean. So I'm not sure what the deal is. Although somebody put up a cloud picture from southeast Missouri from last night showing a cloud formation coming up from Hurricane, I guess it's Marco, right? And then KCMQ in Columbia said that, and I've heard this a couple of times, said that they've made a, Hurricane Laura. They want to rename Polo, so it's Marco Polo. That's pretty funny. So we got a nice day. I'm getting my lawn mowed. I started teaching yesterday my 3 classes, so I taught all day yesterday. Human anatomy and human physiology. Good morning, Eileen. So we're going to do something completely different today. And I started doing this and getting involved with this a couple of years ago. So I did it or I put it up as a brain magnet. Should you get your brain magnetized? And I'm going to kind of explain that to you because that seems kind of like a weird thing to talk about or to even bring up. So we're talking about transcranial magnetic stimulation for people that are recalcitrant from depression therapy. And so we're not doing anything COVID related today, although we have a huge uptick in depression, anxiety, mental health issues, suicide, etc. during this pandemic. And if you or a loved one or somebody that you know is having difficulty with depression and feeling suicidal, this is an option. Because medications don't always work, right? Medications are just one of those things that people take and think, okay, well, this is going to work and all that. I worked with a nurse practitioner, 20 some years ago in Omaha, and Prozac's been on the market for some ridiculous amount of time now, over 30 years, and she was convinced that if she didn't take her Prozac, she would fall off the earth, basically. And she was a nurse practitioner. And I said, well, that's the dumbest thing I've ever heard, because when I was training, depression was acute depression or major depression was one of those things that was like a 3-month medical treatment. And so any of you all that have been on medication for depression for years and don't feel like you're getting better, this is an option. So transcranial magnetic stimulation. I trained as a technician in May of 2018, and I was doing these treatments in Chesterfield Valley, Missouri, 2 years ago. Of course, I live in Boonville, and so I'm not doing that anymore, but there are technicians, and that treatment is available in Chesterfield, Missouri, as well as all over. So if you're listening to me and you're not close to the St. Louis area, it might be a difficult thing for you to do, although this has gotten to be fairly available or very available across most of the country, really. And so what is it? Okay, transcranial magnetic stimulation therapy. So if your depression is resistant to other treatments, which is common, I mean, I hear this all the time. People will tell me, well, I've been taking this medication and they switch me to this other medication and I still have depression. So it's a treatment availability for depression and other mood disorders. It's FDA approved for treatment of major depression and depression. Okay, so it's non-invasive. It's a way to treat people that have depression without invading them. And so if you've watched, let me think of the name of the movie. I'll think of it here in a minute. I'm totally blocking this movie. But anyway, depression is the leading cause of disability in the United States from people to 15 to 44. So 15 to 44-year-olds, disability. You can't work. These people are not able to work because of their depression symptoms. So there's a whole lot of effective treatments for depression. Most of them are pharmaceutical. Cognitive behavioral therapy. So if you go in to see your family doctor or your internist and you say you have depression, they're going to put you on an SSRI, selective serotonin reuptake inhibitor, all the different kinds that we talked about 2 or 3 weeks ago. Prozac is what everybody remembers the name of. But if that doesn't work, and that should work within 3 months according to my training, and if that's not working, that's in concert with cognitive behavioral therapy, seeing a therapist. Psychiatrists tend to write meds. Licensed professional counselors tend to do cognitive behavioral therapy, and this is an option going forward. So if you want to get off medications, this is a possibility for you. So lots of effective treatments for depression, but antidepressants and psychotherapy don't work for everybody, right? In fact, 2/3 of people, so I'm looking at all, I read a whole bunch of studies on this before I trained to do TMS as a technician, but this, doesn't work for everybody. In fact, 2/3 of people don't get adequate relief from the first antidepressant they try, and after 2 months of treatment, at least one symptom will remain, and then each subsequent medication, so the FDA requires that you try 2 before you have TMS therapy. After the first one fails, so 2/3 of them still have symptoms, if you add another medication or change medication, that's even less likely to help. So a friend of mine was a psychiatrist I worked with in Bolivar, Missouri, years ago, and he was kind of like famous, gave talks and etc. all over the country, and he did multi-pharmaceutical drug therapy for depression and psychiatric illness. So what do you do if you have depression and you do not respond? Okay, so electroconvulsive therapy has been around for 75 years. Okay, or shock therapy. That was the gold standard for treatment-resistant depression, and it kind of still is. However, only 8% of psychiatrists offer electroconvulsive therapy. And so ECT, as it's known, requires you to go to an operating room usually, and they sedate you and they paralyze you so that you don't have seizures, because ECT induces seizures. If you remember the movie, I can't think of the name of, Jack Nicholson was in it. I'm blocking this movie. Anyway, so that's everybody's idea in their mind, is that movie with Jack Nicholson where they're using electroconvulsive therapy or electroshock therapy kind of as a punishment. But there's pretty good science behind it, because the brain is an electrical organ. Okay, so the whole idea is, how do you stimulate the brain in somebody who is having recalcitrant or resistant depression symptoms? And TMS, which was FDA approved, I think, in 2013. It's been around for longer than that. But TMS is one of those things that is an option that's not electroconvulsive therapy. Okay. So ECT is the gold standard, still the most potent and effective treatment for this condition. It's used regularly across the country, just not that often. It's way more expensive than the brain magnet or transcranial magnetic stimulation. Okay. So again, 8%. I worked with a guy in Omaha, and I worked with a guy in Midwest City, Oklahoma, every Tuesday he was doing electroconvulsive therapy in the operating room, and he would have 6 or 7 people starting at 7 in the morning. So you're talking about going to the OR, getting put to sleep, getting medically paralyzed, getting the ECT treatment, which is really short, and then having to come out of anesthesia, right? So there's some side effects, and that's true of medical therapy for depression. I mean, if you're taking a medication by mouth or as a shot or whatever, you're basically treating your whole body, even though the target organ is your brain. Okay, so we talk about, I'm going to actually link together depression therapy with erectile dysfunction. Eileen, thank you. It's One Flew Over the Cuckoo's Nest. I don't know why that just flew out of my head. I looked at it an hour ago and I couldn't remember it. One Flew Over the Cuckoo's Nest. So that was like a movie that showed that Jack Nicholson was out of control, and so they punished him with electroconvulsive therapy. But there's pretty good science behind using that. But most people have a negative connotation about shock therapy, right? I'm not sure I would do it. So the same thing when you're, so I told you I was going to connect depression with erectile dysfunction. Okay, so when, the erectile dysfunction medication that you can think of is Viagra, right? Okay, so when I was the medical director for the Oklahoma Men's Clinic, most of these guys had come in, they'd taken Cialis and Viagra. Viagra has systemic side effects. So, I mean, you're taking this thing by mouth to work on your penis, right? It was originally being worked on or studied for cardiovascular benefit, and they found that most of these guys that were taking this medication were getting erections that they hadn't had before. The problem is there's side effects. And the most common one that I heard of the guys in the Oklahoma Men's Clinic was that they would get flushing, and they would get like a blue aura to their eyesight. Well, you're taking a medication that's working all over your body, and the only target organ for that medication, if you're using it for erectile dysfunction, is the penis. So there's better ways to treat blood flow to the penis without side effects. And so that was the whole point of the treatment protocol that we were using at the Oklahoma Men's Clinic. Same thing goes with transcranial magnetic stimulation. We're treating the brain, which is the target organ. Prozac treats your entire body. So, what is it used for? TMS. So it was FDA approved for acute depression on people, or depression on people that have failed 4 medications, which is not a whole lot. That's dropped to 2. It was originally thought that if somebody failed 1 medication, that TMS may help them. Now it's 2. Like I said, 2 years ago when I trained on this, it was 4. So it sounds weird to put magnetic pulses into your brain, right? But so is shock therapy. You're electrocuting the brain, but it is an electrical organ. So the synapse and the neurons talk to each other electrically. So the ECT therapy is based in physiology. When we started my physiology class yesterday, and magnetic therapy with transcranial magnetic stimulation is based on the same principle. Okay, so you've heard of magnetic resonance imaging. So the power of the magnet for TMS is the same as MRI, and you wouldn't think twice about having an MRI. It's a magnet. CT is radiology, it's radiation. The beauty of MRI is imaging your anatomy without getting radiated. So MRI is a magnet, TMS is a magnet, and the strength is pretty much the same. So, TMS has only been approved, so FDA approval for treatment of major depressive disorder in people that have failed medications. Depression is a treatable condition, and so TMS is used when standard treatment protocols like therapy and medication and self-help techniques like grounding, mindfulness, and meditation has failed, or in the case of medication when the side effects are too severe. So some people can't do medications because of the side effects, right? In Europe, TMS is approved for a variety of conditions. So in the US, it's depression only. In Europe, it's being treated for anxiety disorders such as obsessive compulsive disorder. I've read some positive and negative studies on OCD. Most of them, they're small studies, but most of them show no benefit. They have shown benefit for post-traumatic stress disorder by research, stroke rehabilitation, so people that had a stroke and have had difficulty with their brain because of stroke, schizophrenia, Parkinson's disease, Alzheimer's disease, chronic pain syndrome, and nicotine addiction. It's also been used off-label for tinnitus, I always say tinnitus, ringing in the ears, fibromyalgia, Tourette's syndrome, autism, and multiple sclerosis. Okay, so there's several different devices. When we're doing this in St. Louis, it's basically about a 40-minute thing to start off, maybe the first week or so. So you have to be mapped. So they look at a motor threshold in your brain. Okay, and I'll put you up a picture and actually a video later when I get done. I'll show you a video of how this works. But basically, you're putting a magnet on the left side of the prefrontal cortex, and the psychiatrist that is overseeing this has to figure out what is the motor threshold. So you turn up the magnetic pulse and the power of the magnet until you get a flicker of the thumb. So remember, your brain crosses, so the motor motion is on the opposite thumb. So you try to get a little flicker of the thumb on. So you're on the left brain and you're looking for a flicker on the right thumb. That tells you you're at the motor threshold, and that's how you set that. That's how you set your power. It's kind of not a big deal to do. The patients that I've treated and sat with. So you're in this chair. It's a big fancy chair, $100,000 piece of equipment. It's a magnet. It's tied into Wi-Fi. It's tied into the company. So that they can monitor what you're doing and how often you're doing it. So it's kind of nice as far as monitoring you. And then you sit with them. So as a technician, a TMS technician, I would sit with these people for anywhere from 20 to 40 minutes. So the first week, 2 weeks, about a 40-minute treatment, and once you're into the thing, once you get figured out, you're down to about 19 minutes. Okay. The first guy that I treated was into Family Guy, so we would have a big flat screen TV in front of the chair, connected to Netflix and the internet, and so this guy taught me what a great show Family Guy is. So the 6 weeks that I treated him Monday through Friday, I really got to appreciate that show. And this was a guy that had a 19-year-old young man who had been through hell and back with depression treatment and going to rehab and multiple medications, etc., etc. 6 weeks of treatment, he was fine. And actually 2 weeks into it, he was fine. So this is about a 5 to 6 week treatment Monday through Friday. And that's why I say if you're listening to me and you're not from the St. Louis area, I probably can't help you unless you want to fly to St. Louis for 6 weeks and stay. But they're all over the country. Columbia, the University of Missouri Hospital and Clinics has a TMS chair. There are about 5 in St. Louis. The one that I'm involved with is at Body Solution Systems in Chesterfield Valley. It's been used there for about 2 years. We have a treating psychiatrist, which is whose office is right down the sidewalk, so he's immediately available. So it's been kind of an interesting thing to watch develop. I never thought that I would be involved in magnetizing brains. And in my mind, I was imagining doing this and doing magnetic therapy on people and having them walk out into the parking lot like zombies, but they don't. The only side effect sometimes is a little bit of a headache, and so if somebody's getting a headache from being stimulated, you have them pre-treat with a non-steroidal anti-inflammatory medication. That goes away. They can feel like a ticking sensation, like a thumping sensation on their skull. That doesn't seem to bother them. And then sometimes you have to adjust the magnet pulse because of some ticks that you see in the forehead and the eye. They can almost give them. It's annoying more than anything. It doesn't really hurt. So the patients that I've treated really did well on this, and they managed to get off their medication. So you have a psychiatrist that's overseeing this, family practitioners that have patients that are just not doing well, and they've tried 2 or 3 different kind of medications. This is an option for them. It's covered by insurance. That's covered by Medicare. Can't tell you about Medicaid. So TMS is kind of an interesting option other than the one flew over the cuckoo's nest in your mind, thinking of Jack Nicholson flopping around on the table with his grand mal seizure. So I don't see that. There is a risk of seizure with TMS. I've seen 2 different percentages. The standard percentage on seizure is 0.1%. So that's why you sit with them. So I'm sitting with them for 30 or 40 minutes, sometimes 20 minutes once they've gone through their first couple of weeks. So there is a seizure risk, and you just ask them, how you feel. I mean, this is going on. They get a pulse of magnetic treatment about every 5 seconds, so you can hear it. I mean, it's a thump, 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 thump kind of thing, and then there's a break, and then it goes on. For the most part, most people are sitting there watching TV, and so I got to see a lot of TV shows that I hadn't watched before. Seizure risk 0.1%. I saw one study that showed 0.001%. Well, that's a totally different percentage, but it's rare. ECT induces a seizure, which is why they take people to the OR and put them to sleep and medically paralyze them so that they're not flopping around on an OR table. So it's a valid FDA approved, not cheap, probably $8,000 for a 6-week treatment session, but it is covered by insurance if you code it right. And of course, I know how to code, so that helps. So TMS, transcranial magnetic stimulation. The system that we use is made by Neurostar. I'm going to put you up a video when I get done, which is going to be pretty quick, on how that looks and how it works and what the deal is. So I think depression is a big deal in the past 6 months. Suicide risk has risen, and one of the best indications for TMS therapy are people that have failed medication for depression and have suicidal ideation. Seems to work very well for that. So I will talk to you on Wednesday, Friday. I'll talk to you on Friday. I just started my semester at State Fair Community College. We had a great day. It's weird. We're on campus. Everybody's masked. We have to spray down our desks, etc., etc. And I'm limited into how much time I can actually lecture these students. I've got 3 different classes, I've got 50 minutes to go through 28 chapters of a huge textbook. So I told him, I said, well, maybe you're going to have to watch my Facebook Lives, and I'll teach on Facebook Live or Zoom in addition to being on campus. We'll see what happens. I told them how to protect themselves yesterday. So I did 2 classes on how to go back to school as a teacher, a staff member, as a student, and how to protect yourself and not get sick. Hopefully they listen to me, and they're taking their zinc and their quercetin, or they're taking black seed oil or fish oil. So TMS, look up Body Solution Systems. The phone number there is, if you're in the St. Louis area, 636-532-0700. Or you can text me if you've got somebody in the St. Louis area that you're interested in maybe referring or talking to about this. My number is 636-891-5055, and my business email address is brianjtracymd@gmail, BRYANJTREACYMD@gmail.com. And I'll talk to anybody about TMS. It's fascinating therapy. It's fascinating to watch. They do really well, minimal side effects, and no convulsive one flew over the cuckoo's nest stuff. And thanks, Eileen, for reminding me of the name of that movie. It flew completely out of my head once I got on camera. Okay, I'll talk to you Friday. We'll come up with something different on Friday. And you all have a great day. It's a beautiful day here in Boonville. Peace and health to you all, and I'll talk to you later. See ya. Bye.